So there is a lot going on at UT Southwestern to try to understand and develop new treatment options for kidney cancer, and you will hear about that today. You will hear about some of the progress that is being made in kidney cancer, and you will also be given an overview about where we are with kidney cancer today.
The talk today that I'm going to present to you is on minimally invasive surgical options. And so in particular, what we're treating are smaller renal masses. So these renal tumors are generally, like I said, smaller. We classify them as less than 4 centimeters. Where if you were going to go and have this complex tumor resected, you were either going to have the complete kidney removed or you're going to have a large incision. To what you see on the right, which is a series of small incisions, about 5 or 6 of them, and each less than a centimeter.
With high enough dose of radiation, all essential cellular processes in the cancer can be disrupted. In addition to the typical gantry that produces the radiation, a C-arm is added, which is another source of X-ray. So while the patient is getting radiation on the table, we are able to do a CT scan and see the anatomy inside and see exactly where the radiation is going.
When kidney cancer gets large, kidney cancer cells will invade into the blood vessels, and then kidney cancer cells will travel. Where do they go? The most common place where they go is the lungs. So for patients in whom the cancer has spread, we need a form of therapy that is going to reach everywhere. And that's medical therapy, and that's what oncologists do.
Is there any correlation between whether it's smoking, diabetes, obesity, carbon in the atmosphere, and the relationship to tumors that we're getting and seeing so much of? Ours is just because we have such fine imaging now that we see things that we didn't know before.
We see kidney cancer in a higher percentage of people who smoke, but we're not sure that that's the exact cause.
Over the last 11 years, I've learned to interface between the cancer communities and the research communities and the clinicians. So there's 3 groups that we want to talk to. So we're basically, like I said, the interface between these communities. So come to us with any questions and we will forward them up.
Please know that we do care and we want to make this trip, this journey, whatever it turns out to be, we want to be a part of it and help you.
What's really fundamentally different about the kidney cancer program than a research laboratory or a clinical hospital setting is that these folks are working together.